Hey, it's Josie Marie, and thanks for watching. Today for Quarantine Check-In, I'm reaching out to a good friend of mine, New York State Senator Kevin Parker. He represents the 21st District here in Brooklyn, and in a time where we're all facing so much uncertainty, we're looking to our leaders in the government to give us some kind of answers and maybe some kind of hope too for the future. Of course, we'll check on him and make sure he's doing all right. But also, I'll try to get some questions answered that you may have so that we can see how we can move forward together. Let's give him a call. And I have Senator Kevin Parker on the line. Here he is. Say hello. We see that you have a new look lately in the videos we've been posting on Instagram and all the social media platforms. We have a new beard. What's going on?
It's the Corona beard. You know, we doing this to rally through this crisis and this pandemic. So, you know, just rocking it for now. We'll see what happens afterwards.
Yeah, I think a lot of us are fans. So hopefully we get to see it longer than the Corona lasts.
Yes.
Speaking of Corona, before I just jump right into it, how are you doing?
Thank you for asking. I really appreciate that. I'm as good as I can be under the circumstances. I'm personally healthy. My family's healthy, thank God. You know, I've actually lost some friends, lost a really close friend the other day. Thank you. But I'm personally okay.
And how is the mental health of you and your colleagues?
I think, look, we're fighting through. You know, I think a lot of us understand that we were called for such a time as this, and we're trying to step up and make sure that we can help as much as we can. You know, every day I begin my day by texting or calling 10 to 12 people I know who have COVID-19 and making sure they're okay, make sure they have what they need. Just checking in with different people, then usually calling through to a number of the institutions to see if we can be helpful, primarily the hospitals to make sure they're okay. And then obviously checking in with the mayor and the governor and their people to see kind of what resources available, what new programs are happening, and trying to help move things. And then throughout the day, there are various requests that come through my office, staff members around, you know, individual requests, institutional requests, and trying to respond to them.
How do you think this whole coronavirus is being handled within the government from, you know, this level, but also federally?
Yeah. So first of all, you know, you can give the president and the federal government nothing but an F. They have, I think, you know, mismanaged this thing from the very beginning. I think how the president's handled this has been heinous and horrible from the beginning. Congress is, I think, doing a better job. They're trying to get there, but the Republicans are such lapdogs for the president that it stops them from doing the things that are right. They did a $2 trillion deal that underfunded New York State that has the most cases worldwide. Out of $2 trillion, we only got $11 billion, which sounds like a lot of money for you and I, but it's not nearly enough money to handle this crisis and what we're dealing with. So let me actually say that I want to thank my constituent, Senator Chuck Schumer, you know, Congresswoman Yvette Clarke, Congressman Hakeem Jeffries, Congressman Greg Meeks, and Adriana Espaillat, Congresswoman Nydia Velázquez, and the work that they've been doing in Congress, and thank them for serving us well. But, you know, in terms of what we've been able to get and what we should be getting as a state, especially as the second largest state in the entire country, is really just, and more importantly, the state that's been hit the hardest, not just in the United States, but literally in the world. There's a lot more resources that we should be getting, and we're not getting them, and it literally is costing people's lives. On the other hand, I want to give a lot of credit to Governor Cuomo and the work that he's done. And I think by and large, he's handled it right. The mayor, I think, has done a fairly good job at handling the crisis as well. I think they've been super responsive to certain things. But I think that there's a lot of lip service being given to health disparities, particularly in African American and, you know, Latino and Latina communities, and we're not getting the kind of attention that we should be getting, given how disproportionately this virus is hitting our communities.
One of the things that you mentioned is the funding. Small businesses, right? We're being told that there's going to be some kind of relief for small business owners and such. And we're having to apply for so many different programs. When is this going to be tangible, and when can we expect it?
Well, again, the congressional delegation has delivered about $11 billion to the state of New York. About $5 billion went directly to the state in a lump sum that only can be used for corona-related activities. In addition to that, there was about $4.3 billion that went to the MTA and mass transit around the state to deal with transit needs. And then nationally, there's about $30 billion worth of money in the SBA, the U.S. Small Business Administration, mostly in the Payroll Protection Program, right, the PPP that you've probably been hearing about. And if you heard the news today, all that money is gone already. Like, they've burned through about $200 million already. And so I would tell, if you're a small business and you still need help and haven't started the process, the two places that I would start is the Small Business Administration on the federal level, right? And then the other place I would start is the New York City Department of Small Business Services. And I would just go to their websites and look at programs they have and try to apply to some things there. If people need specific help, you can always reach out to me, and me and my staff will get back to you as soon as we can and try to connect you with the right resources.
Yeah, and I can actually attest to the fact that their office is really responsive. You can definitely reach out to him. Is there a plan, or is there something happening to release nonviolent prisoners who may be vulnerable?
Yeah, both on the city, state, and federal level, there are programs that are now releasing numbers of non-violent felons. And so we've already, out of Rikers, have released over 1,000 people who are non-violent felons. And we're now looking at the same kind of dynamic on both the state and the federal level. But we're not, in no way at all can we just empty the jails.
Right.
But certainly people who are non-violent criminals, we're certainly looking at providing some relief for them so they can get proper treatment and not necessarily be in prison where frankly, the coronavirus has spread like wildfire.
Yeah. So now as a resident, I have this question of safety. Now I understand that the prisoners who are going to be, or who have been released, are non-violent. What kinds of crimes have these people committed to end up in jail in the first place? So what kind of categories are being considered as non-violent?
Yeah, the vast majority of them are white collar crimes. People who've embezzled money or stole things. Sometimes they're drug transactions that didn't involve a weapon, and so typically those kind of those offenses. Stole something, hopped a turnstile, those kind of things. Destruction of property, those kind of things. But no one who's actually committed like a murder or a rapist or something like that. Those folks are not even being considered.
Is this release permanent?
The release is permanent.
Wow.
Right.
Interesting.
And we're also considering people who have served a significant amount of their time as well. So if you're somebody who has, you had a 30-year sentence and you served 25 years, then they would probably consider you as somebody, even if it was a violent crime. If you served the vast majority of your time, and obviously people who may be up for parole, they're kind of reconsidering those folks as well for release.
Okay. So what you're saying is we should not be concerned as prisoners are being released.
Correct. I think that I think the state of New York is doing a proper job at weighing the cost benefit and the risk of release, and only doing it when we're fairly certain that person is not going to recommit a crime, and particularly somebody who's going to not commit a violent crime.
Okay. They just announced today that the lockdown is going to last until May 15th. Is that correct?
Right.
Okay.
Yeah, another month.
At least.
At least.
Do you have some inside information, Parker, that you can give me here as to like when we're really going to get out of lockdown?
We're going to get out of lockdown exactly when we determine that it's safe to do so, without fear of a second wave of coronavirus hitting us. There's already some conversation that we may be looking at a second wave sometime in October. What the worst would be is that we open up society too fast, too soon, and then we wind up with even more deaths, which is what happened back in 1800s when we had, 1918 when we had the Spanish flu situation, right?
Mm-hmm.
When it came back the second time, it was actually deadlier than it was the first time. And so everyone is just really concerned that, that we don't wind up in that dynamic. And so we're following the science and we're following the numbers.
Mm-hmm.
We expect, given the current modeling, that in a month we will be in a period that we can start relaxing, but that may change.
It's a very scary time, and it's a very scary thing that you said earlier, that projections show that there may be another wave in October. And with that understanding, what you said previously is that we're not going back to normal until we're sure that there would be a second wave. So right. Should we be expecting to be in this, oh my God, this is giving me anxiety. Should we be expecting to live like this until October, until the new year?
Longer. What the governor's indicated and what Dr. Fauci have indicated is that we really are not talking about being in a post-COVID-19 reality until after there is a workable vaccine. We are at least a year to 18 months away from a workable vaccine. And so until that moment, even though things may in fact go back to normal, us just not going to go back to normal. And part of what we're dealing with is figuring out what the new normal is going to be. We're not in a new normal, right? So we're not going to be socially distancing forever. But when we start to relax social distancing, there's still going to be some measures that we're going to have to do. But getting to a place that looks more like what we call normal, it won't happen until we get a vaccine. And that's, somewhere between a year and 16 months away.
So guys, brace yourself.
As I said, 18 months away.
Yeah. So we have to kind of find ways to stay sane, not just stay safe, but also stay sane during this time, because I can say for myself, it's kind of starting to drive me crazy. What are some tips that you can maybe give us to stay sane so that we don't go crazy and just lose it altogether during the quarantine?
Yeah, look, this is very upsetting for a lot of people, right? Especially for those of us like myself who live alone.
Yeah.
And so you really have to do other things. So the first thing is facts over fear, right? Facts over fear. Understand what's happening with coronavirus. Stay up to date. Make sure you're looking at credible news sources and information sources. Just don't click on everything that pops up on Facebook and think that it's legit. The second thing is that don't watch the news all day. I'm going to be honest with you. I watch an hour of news and I watch the governor's briefing on TV. Other than that, I'm watching whatever has superheroes and hobbits and aliens on it. Like, I'm watching Escape TV for myself.
Yeah.
The other thing is too is that this is a great time to do all the things that you said you wanted to do if you only had time. I have a beehive that my staff bought me that I've been saying I want to keep bees in my house. So I'm taking an online course about being a beekeeper.
Really?
I'm spending my time doing. Spend some time during the day exercising. You can even go outside to the park and run by yourself. Just stay away from other people. But the other thing that's really more important than anything else is, although you're socially distancing, you don't have to socially isolate yourself. Mm-hmm. So stay connected to family and friends. Call them, email them, text them, even video chat, right? But stay connected to other people. Talk to other people. If you feel like you're getting down, you feel like your routine is getting disrupted, right? New York State has also created an emotional support line. Mm-hmm. And so if you feel like you need some emotional support, New York State has a line.
Yeah.
But like I said, take care of yourself. Mm-hmm. Eat well, get sleep, right? Because that's important, even in terms of keeping your immune system up, fighting the virus or whatever. Get sleep, eat well. Take your supplements or whatever you're doing. Drink whatever bush tea your grandmother left you a recipe for.
Yeah.
Do all those things. Take care of yourself. But more importantly, take care of each other, because we're only going to get through this together.
So those are all great tips, and those are really great resources that you shared with us, and I'm certainly going to be using some of those.